What is your name and tell me a little bit about yourself?
Well, my name is Betty Del Valle. I am a registered nurse by trade. I've been a registered nurse for a little over 20 years now, and currently I'm the Director of Nursing for Critical Care Services here at Memorial Hospital West in Pembroke Pines. I can tell you that I have been, well, obviously in the medical healthcare field for over 20 years, and particularly in leadership. I've been in leadership for approximately 12 to 15 years.
Oh, great job, great job.
Thank you.
All right, Ms. Devalle, what made you choose this career of choice?
Well, to be a registered nurse takes a very special calling, I should say. And just like any other profession, there has to be a certain passion and a drive to make you want to do what you do. And in healthcare particularly, especially when you're at the bedside, the calling typically for most nurses is to want to help people and to be compassionate. And for myself, that's what led me into choosing this profession. Personally, having had a history of illnesses in my family led me to want to be a better person and to help individuals. So that's why ultimately I became a registered nurse.
Now, can you describe what you do in your field?
Certainly. As a director of nursing, I oversee 24 hours operational issues over particular areas. In my case, critical care services involves all of the ICUs, surgical and medical ICUs, of course, as well as the intermediate care, which is an IMCU for the congestive heart type patients. It also includes our oncology services here at Memorial Hospital West. And ultimately, as far as operations go, we need to ensure that we obviously provide the best medical care, best quality medical care as we can for our patients. I respond to any concerns or patient complaints, physician complaints. I oversee our monthly budgets to ensure that we're running as close to budget as possible, and ultimately oversee all the issues and concerns related to our employees. Currently, I oversee approximately 500 to 600 FTEs, employees.
And what are FTEs?
FTEs are considered full-time equivalent employees. So for instance, if you have 2 part-time employees, they might equate to 1 full-time equivalent employee.
All right. Now, how does HIPAA affect you within this field?
Actually, HIPAA greatly affects us in the healthcare industry because everything we deal with related to our patients is confidential or should be kept confidential. Anything ranging from their demographics, something as simple as where they live, how to contact them, what their health insurance information is, payment information is, all the way to their medical care and their treatment. So when you look at it overall, you can ultimately say that HIPAA is an overall confidentiality protection for our patients and everything about our patients. Something as simple as just having a conversation with someone back home and speaking to them about our patients. That's obviously something that we should not do because we want to protect our patients' information at all times.
Now, moving on with the privacy laws, what do they mean to you and in this field?
Privacy laws are all-encompassing as well. Not only does it pertain to patients and the care of our patients, but just in general in relation to our industry, to our organization as well. We want to ensure that there's certain things that we maintain private and keep within our own organization versus publicly sharing them. So that's a little bit different from transparency. Transparency, we want to ensure that we're able to share certain information openly, but at the same time, we must maintain a sense of privacy that is not all out there spilled as some sentinel, shall we say. So that's the differences for us and how it impacts us in healthcare.
Okay. Now, according to the HIPAA and the privacy laws, what systems do you have in place to make sure that you all abide by them?
Sure. I can speak for Memorial Healthcare System. We have many processes in place, starting from the moment an employee is actually hired. They undergo an orientation that discusses HIPAA in detail, educates the employees no matter what aspect of healthcare they're in, as long as they're employed by the healthcare system. So we begin there, and then ultimately we also do have what we call annual review, where HIPAA, along with many other items such as safety and risk management items, are also reviewed with each and every employee. Some of the other things that we have that help us to protect our patients' privacy and in order to maintain confidentiality is we have certain systems in place where individuals can't utilize other passwords, other employees' passwords. We're asked to change our passwords every 90 days to help maintain that sense of security, shall we say. All our medical records are electronic medical records. So because of that, we're always able to see who's been in a patient's medical record and go from there if we need to.
Awesome, that's pretty good. Now, talking about ethics, do you have a code of ethics in your facility?
Actually, we do. We have a very strong code of ethics that all employees must abide by. And something that we've put into place in the organization in order to ensure that we do our best to abide by our ethics, our code of ethics, is a compliance hotline, we call it, and it's totally anonymous. So should someone witness something that is unethical, we ask them to please feel free and contact or make the phone call to our compliance hotline and report whatever it is anonymously. And of course, we have those at the corporate level, the risk managers and our corporate compliance officer who do detailed investigations on whatever the accusations may or may not be. Other things that we do as well is we have our employees sign a contract, a code of ethics contract, ensuring that they're, for instance, that they're not conducting any other form of business outside of the organization that may compromise what we believe in here at Memorial.
Now, not only are you looking professional, how does professionalism pertains to you within this field?
Well, as you mentioned, one of the most important things, or maybe not the most important things, but certainly the first thing that people see is our appearance. So it's always very important to carry oneself in a professional manner, whether it's in the form of dress or in the form of the way someone communicates. We have a variety of things such as a policy on dress code, and depending on what field you work in healthcare, there's certain guided policies that tell you how to dress and how to conduct yourself. Other things that involve professionalism are time and attendance. So for instance, we are very strict on how we carry out that policy as well. We need to ensure that as working professionals, we are committed to coming to work every day and being on time and punctual to do so every day. So those are some examples of how we expect our employees as well as ourselves as leaders to conduct ourselves in a professional manner.
Awesome. Now, if there was something in this field you could change to have a better outcome for you and the patient, what would it be?
If there was something that I could change, that's actually that's a tough one. Fortunately, I'm blessed in where I work and doing what I do, that I'm able to help others. And this organization, as I mentioned earlier, is one of those that really has a heart. We always put our patients first. As a matter of fact, that's one of our themes is patients first. So quite truthfully, I'm not quite sure if there would be something I'd change. Possibly if we could have family members more so engaged some cases we do have patients who do not have either family at all or family present. So if there was one thing that I could change, I believe it would be to always have someone be that voice for the patient and be that patient advocate, no matter if they have family or not, or no matter who they are. I believe that in the long run, that would be the best care that the patients could always receive when they're engaged and their families are as well.
Before we continue with the last final question, I want to thank you so much for your time and your services. I want to appreciate everything you do, more in and outside the work field.
My pleasure.
All right. Thank you so much again.
You're very welcome.
For the last question now, who helps you to where everything in your facility runs smooth and efficient?
Well, what I can share with you, Raven, is that through many years of on-hand experience, one thing that I was very fortunate to have was many mentors that helped to guide me and teach me and give me advice. And once a mentor, always a mentor. You bond and you have a good, strong working relationship, and you can always turn to them should you have any needs or concerns, or just someone to, I guess, voice your thoughts to, bounce them off of someone. So that's always very important. But most importantly, in order to be successful, whether it's this industry or any industry for that matter, I believe the most important thing is to surround yourself by a strong team of individuals who all have the same purpose as you do, and all are striving towards the same sort of success, and you're all on the same page. One of my mentors told me many years ago, in order for you to look good, you need to surround yourself by those who even know more than you. And quite honestly, if they don't look good, I don't look good, we're all a team, and this can never be done on one's self. It must be done collaboratively, and we gain more together than alone, always.
All right. Thank you so much.
You're welcome. Thank you.
I want to thank Ms. Betty Leviat for her time and consideration for giving us this wonderful interview today. The information she provided was not only educational, but was very engaging. She provided us not only the insights of what a director of nursing do, but she gave us a little bit more of her personal side of what she actually does within this field. I want to express my thanks and gratitude to Memorial West Hospital. And critiquing this interview, yes, her responses were long, but they were very informative, and I couldn't ask for a better interview in itself. Thank you so much, and I hope you enjoyed this video. In conclusion, in medical ethics, I learned that law is intertwined with everything, with your moral beliefs, how you feel about anything, your religion, everything you feel, that you personally feel, that you grew up with in the medical field also deals with law. You have to be very careful within your patients, with their laws, and not with their laws, but with their religion and everything, to make sure that even though you're trying to comfort them, you're still abiding by the law and within your rules and regulations, even though they have their own personal beliefs and ethics. As long as you follow the code of ethics in your medical field and outside your medical field, everything should be perfect. This class has taught me so much that I can definitely apply within the medical field, and some things that I would definitely be able to apply is the one thing that means a lot to me is the religion. As long as you follow with whatever religion, whatever God you believe in, and is within the laws and regulations, like I said previously, I'm okay with it, and I myself will be a happy employee of the medical field. Thank you for teaching me everything in this medical ethics class, and I appreciate it. Thank you.